Hello, everyone, and welcome back to another episode of the Concussion Nerds podcast. Today, we're talking all about sleep. And because this is not my area of expertise, I have asked my friend, Dr. Shane Creado, to come join us. Shane is a psychiatrist, but a sleep doctor, there we go, and specializes in sleep with athletes and brain health. And you've done a slew of things, Shane. Can you give us a little bit more about you, who you are, where you're from, and why you are so passionate about working with sleep?
Thank you, Dasha. Thank you for having me on. And I'm so glad everyone's listening in today. So, as you know, I'm board certified in psychiatry and sleep medicine. I started on this path with first doing physical therapy and then med school and then psychiatry. And then I realized in psychiatry, we weren't really focusing on sleep as a core aspect of mental health when it should be focused on as an individual and core aspect of mental health. And so I did a sleep medicine fellowship and then was also involved in sports psychiatry at the time. And even in sports psychiatry with elite athletes and teams, sleep was not really given much attention unless there was a major problem. And then the more I learned about sleep and mental health, the more I realized how sleep is in the core, if not the most important factor when it comes to mental health and concussions and recovery and really optimizing your quality of life, whether it's your blood pressure or risk of heart attacks or dementia or cancers. And so I kind of devoted my life to using sleep as a performance enhancing tool in athletes, but also for anyone else who has issues with sleep, not just normalizing their sleep, but getting them to be optimized when it comes to their sleep and performance, whether you're performing as an athlete or want to be the best mom you can be or the best employee or CEO that you can be. And so I've been involved in sports and sleep for a while now. I'm on the board for the International Society for Sports Psychiatry, affiliated with the US Olympic Committee, the NBA Players Association, PGA Tour Europe. And I wrote a book called Peak Sleep Performance, where I have all the skills that I teach my elite athletes for anyone to have access to. So it's been a passion for a while. I'm just grateful to have the opportunity to share this with more people and help anyone who listens to us.
Oh, I love it. And so, funny story, I think sometimes as humans, right, when we see someone or we read a book they wrote or we look up to them in some ways, we forget that they're human, right? We forget that we can maybe actually reach out and have a conversation with someone. And so, this is exactly how Shane and I met. I read his book. I don't even know how I found it. I no, you know what it was? I heard you on a podcast. I can't remember what podcast it was at all now. But I was like, this book sounds really fascinating. I went to Amazon. I bought the book. I read the book. I loved the book. I have pages highlighted in it. I took pictures of it and I sent it to my social media person. And I was like, make a post about this, but give them all the credit because this is not mine. And then I was like, you know what? I'm just going to reach out to him. And so I think I sent you a message on Instagram and I was like, I loved your book. Here's who I am. I'm super interested about sleep. Like you must see it in concussion. And then we started just chatting more. And I love when social media serves its purpose. And I feel like for us and the way we've connected and continue to have a friendship, it's been amazing. And I love that that's how we met. But it was because of your book.
So natural. I've met so many amazing people in this journey, and we're like sleep warriors chasing this down to spread the word because it's free. Sleep is free and it's doable, it's modifiable. That's what's so exciting about it. We can change it.
I love it. So let's dive right in because, so as you well know, everyone pretty much listening to this podcast has either had a concussion, has a loved one who has a concussion, or they're like you and I who are clinicians and professionals who work with individuals who have concussions. And on the flip side, we're professionals, we're CEOs, we want our brains to function amazing too. So we hear all the time about how sleep is so important to our health and our healing. That's a really broad, big statement. My listeners like details. Can you give us some details about what actually happens in sleep that helps facilitate health and healing?
Right. So the main thing about sleep is that it's your number one recovery tool. We can do cold plunges, we can do hyperbaric oxygen therapy, saunas, all of which is super helpful. However, sleep is number one. It's right up there as the most important recovery tool. I say it's charging your battery. It's renewing you from the DNA level within the nucleus in your cell all the way up to your entire body. So sleep regulates an anabolic switch. So it's building rather than breaking stuff down. And during the night in your sleep, your bones are building up and remodeling themselves. Your muscle tissue is being repaired and added to the body. Your DNA is repairing. If DNA repair is faulty, you result in increased risk of cancers. Your cells repair. Your immune function is boosted. Your testosterone and growth hormone levels, which are anabolic hormones that build up your muscle, and muscle is a major metabolic organ, improve. Your RER, your respiratory exchange ratio, reduces. It's supposed to fall because if it's increasing, that means you're breaking down healthy muscle tissue, repairing micro tears in your muscles and your ligaments and your tendons, and reducing inflammation, reducing stress hormone levels like cortisol, and truly helping brain healing. So that's the musculoskeletal implications. On the neurological side, think
Mhm.
about dementia reduction. In your deep sleep, drainage channels open that are called the lymphatic system that flush out toxins that build up during the day. And in your dream sleep, you consolidate the memories that you built during the day as well. So if the drainage channels don't open in your deep sleep, increased risk of dementia down the line. And if you don't have enough dream sleep, you won't remember what you studied and you won't be able to recall information the next day. You won't be able to learn information the next day. And there's evidence to support this as well. Matthew Walker with his studies on MRIs and found people who had one night of no sleep, 40% reduction in the ability to make new memories, which is
Mm.
shocking, but not surprising now with all the data we have. That's with the brain health, with mental health, sleep problems, concussions directly related to, mood instability, depression risk, anxiety,
Mhm.
ADHD symptoms that are misdiagnosed. People have sleep apnea or insomnia and they put on stimulants. So, in terms of general health, neurological health, immune health, risk of cancers and infections, emotional cognitive health, and musculoskeletal health, sleep is foundational.
And so when you were talking about like the dream sleep, so when I think of sleep, I always think of stage one, two, three, four, and REM. So where is dream fitting into that? And if I don't remember my dreams, does that mean I didn't reach dream sleep?
Ah, great question. So, N1 sleep is called light sleep. And you won't even feel like you're sleeping when you're in N1 sleep or light sleep. Then there's deep sleep, which is stages 3 and 4. Those are deeper stages of sleep. And stage 2 sleep is kind of like deep, but it's where you have more memory consolidation as well. But deep sleep is 3 and 4. And then you
Okay.
have REM sleep. REM is rapid eye movement sleep, where most of
Mhm.
our dreams occur. Most of our dreams occur. So if you don't remember your dreams, it doesn't mean that you're not getting dream sleep. And please don't trust those wearables. They're notoriously inaccurate. There's a couple of reasons why we don't remember our dreams. One is that our dream sleep cycles so quickly in and out that oftentimes it's not sufficient time for those dreams to be encoded onto our memory circuits so that we remember them the next day. They bounce on and
Oh,
off really quickly. It's like if you have a cursory glance at a piece of paper and then you're moving on, you won't retain that information. But if you look at it and want to remember something, you're more likely to remember it. Another way of remembering your dreams actually is sometimes we're waking up, we know we're waking up in the morning and we've just been dreaming. Don't open your eyes, okay? Keep those eyes closed and try and recall as much of the dream as possible. The reason being that you're actually encoding whatever you remember into the memory aspects. And then when you wake up, your eyes, they break the connection with the back of the brain, the occipital lobe that retains the visual memories, and you'll remember the dreams. But if you just open your eyes, you'll be like, I was just dreaming and I don't know what I was dreaming about. Do I have dementia? No, there's a technique to remember your dreams a little better.
absolutely. And I am that person who like dreams I'll usually remember, but freaking nightmares. I am the person who I will wake up out of a nightmare and then I don't want to go back to sleep because it literally picks up right where it left off and just keeps going.
Yeah,
Like,
well, emotional memories are the hardest to remove. You're waking up out of the dream, which is why you remember it so well. So what I
yeah.
suggest you do is, go to the bathroom, take a few deep breaths, maybe go to the couch, dock area outside of the bed, do some deep breathing. And when your emotional circuits calm down a little bit, then get back to the bed. And it's much less likely that you'll get back to the nightmare.
Okay, I'm gonna try that. I usually like try to calm myself down, but I never like get up and go do anything. So funny question, because I was literally when you're like, don't trust the wearables, because I was literally about to ask you. So obviously I wear an Aura ring, as does everyone else on the planet.
Yeah.
And Aura ring shows you like this was your deep sleep, this was your and I say to everyone, like, unless you're in a sleep lab with all the stuff, like it's not gonna be super accurate. But my ring will give me an idea of like this is the amount of light sleep you've had in a night. This is the amount of deep sleep you've had in a night. Just out of curiosity for myself, what is that ratio of how much deep sleep do we want? Say I'm going to bed and I'm just getting 8 hours of sleep. How much of that, or is there like an ideal amount of that that you would like to be a deeper sleep state?
Yes. So, I mean, let me clarify when I say that the wearables are terrible, right? What I mean by that is that it's important to know that nothing is accurate in terms of deep dream light sleep. But as rough measures, it's okay. It's okay to use it
Mhm.
as total sleep, total wake time. Sure, no problem. Also, if you're the person comparing your sleep and total sleep time, wearing the same ring every night, and you kind of correlate it with less sleep on the ring versus not feeling well rested when you're waking up, and there's a correlation you found, then sure, because you're your own control. Fine.
My subjective one.
Yes, exactly right. So the goal is to get maybe 75% of your sleep on average. They say, between 55 and 80% of
Mhm.
sleep should be deep sleep, and REM
Okay.
sleep maybe 20 to 25%. Now,
Okay.
when I say REM should be 20-25 and deep sleep should be 55 to 80, there's a huge range there. So if you're getting maybe 20% of light sleep and the rest is deep sleep, so two, three, four, that's fine. But the golden rule is if you're waking up refreshed and you're getting adequate amounts of sleep and regular timings of sleep for the most part, you're doing fine.
Mhm. Okay. I like all that. Let's talk about TBI for a second because obviously you've seen concussion, obviously, and that's all I see is concussion. And I've obviously done some reading into the sleep research and, they say like up to 70% of individuals with TBI, their sleep is disrupted and they struggle with sleep, whether that is they become insomnia and they have trouble falling asleep, or they are sleeping more, or they're randomly just like falling asleep, or they're just not waking up refreshed. So this is a big problem, I feel like, in our TBI concussion space. And I don't feel like it gets enough attention because honestly, I don't think enough of us know how to support in this space besides trying to teach like basic sleep hygiene, which we're going to talk about that in a second too. So I would say, in your experience, in the concussions that you've seen, either through the Amen Clinic or in your private consulting that you do, what are the common things that you see concussion has the effect on in sleep? And what are some of your kind of immediate steps to support, I guess, the person in concussion recovery?
Yeah, so that is so right. That is so true. Sleep is not given enough attention to people who've had a concussion. And as I said, sleep is a key recovery tool for the brain. And so if you're not getting enough sleep, especially after concussion, you're really setting yourself up for disaster. So when we look at studies, there's tons of studies with cross athletes and injuries and concussions. Meta analyses in the literature are pooled data. They choose the most rigorous studies, the best studies, the strictest studies. They mash them together, and then they look at what those results show, the pooled results. And meta analyses of over 1,700 survivors of traumatic brain injury across 21 different studies found around half of those people with head injuries have insomnia, which is huge because it's going to destroy your ability to recover the brain properly. Sleep apnea is present in the general population between 2 to 15%, but in TBI patients, sleep apnea is prevalent in 23 to 36% of them.
Oh,
And
wow.
sleep apnea could be obstructions in the airway, it could be The brain is hurt, and so it cannot regulate your breathing properly while you're asleep. On the scans, we do the AIM clinics, the first imaging study on NFL athletes back in 2009, and they've hated us ever since, sadly. It seems that the same patterns we see on those with a head injury are the same patterns you see in people who have sleep apnea that's untreated. Sleep apnea is a major, major aspect. We need to screen every single person who's had a head injury for sleep apnea through questions, maybe a sleep test as well.
So, as physical therapists, because especially in small towns, like we don't have to get a sleep study is a pain in the butt. I would say, is there an outcome measure or something that you know that, or a screening tool that we could use as an allied health practitioner and colleague to help start that screening process to know if we have to try to support our client through finding and connecting to a sleep study?
Yes. So if you're talking about the average population, there's a good screening tool called the Stop Bang screening tool. It's an acronym.
Okay.
So you have to, if is it a male, yes or no? If it's a person over the age of 55, do they have a neck circumference over 16 inches? What's their BMI? Is it over 35? Do they have hypertension? Those are some of the questions on the Stop Bang screening tool. It's free, it's available online.
Okay.
But we need a much lower threshold for those who've had head injuries, right?
Yeah.
Will an athlete or a college gymnast meet those criteria? 55-year-old obese male? No, right? I haven't seen any cheerleaders who fit that demographic, but they may have had a head injury and it may increase their risk of sleep apnea. So you'd have a very low threshold when it comes to athletes or the average population. So in that case, I would ask them questions like, with the amount of sleep you're getting that you've had prior to the head injury, are you feeling refreshed and waking up? If the answer is no, warning sign. Okay. Does your partner say that you stop breathing or snore at night? Warning sign. Do you feel that when you wake up, your mouth is dry, you have a headache or brain fog? It's hard to get going. Warning sign. Maybe you wake up okay and refreshed, but then you're feeling sleepy in the daytime or in the afternoon when you used to not do that previously. Warning sign. So those are some clues that the head
Mhm.
injury may have messed with their sleep quality. Because they're getting the same amount of sleep, but
Yeah.
cognitively, emotionally, functionally, alertness wise, they're not functioning the way they used to previously.
I love that. I'm going to work those questions into my assessment.
Absolutely.
And I totally cut you off in the middle of your topic. So
I
we were
was
talking
just
about sleep apnea and
Yeah. So, when with a head injury, the risk of sleep apnea increases exponentially. Insomnia, half the people who've had a head injury. Excessive daytime sleepiness in people with head injuries ranges from 50 to 80% of people with head
wow.
injuries versus the general population with excessive sleepiness of 10 to 25%. There's actually acquired narcolepsy or hypersomnia, excessive sleepiness. And so that's when, there's a good test like the Stanford Sleepiness Scale or the Epworth Sleepiness Score. And then from the Epworth, they
Mhm.
score more than 10. It means they're excessively sleepy. Now, they could be sleepy because they're not getting enough sleep, or getting enough sleep, but they have sleep apnea, or
Mhm.
they have acquired narcolepsy or hypersomnia after the head injury. So the Epworth has good questions, right? Or how likely is it for you to doze off when you're reading a book, when you're lying down to rest in the afternoon, when you're in a car as a passenger? Those kinds of questions. That kind of quantifies how the sleepiness affects their functioning. If it's functionally impairing over 10, sleep study.
That is so helpful. Thank you. I love that.
Of
So
course.
let's talk about that excessive sleepiness thing for a bit because almost every TBI client has fatigue and excessive fatigue more than normal because they don't sleep as well. And now we know some questions to dig into that. However, the topic always comes up about naps. Should I nap? Shouldn't I nap? Is it good? Is it bad? How long should I nap for? What do you got to say about naps?
There's a little bit of a rewind here. There's a big difference between fatigue and sleepiness.
Oh,
So, fatigue is tiredness. You're exhausted. Run a marathon, hard to get off the couch, but you're not dozing off. So that's fatigue. Now, fatigue is major component of post-concussive syndrome. Yes, due to various
Mhm.
factors like hormonal imbalances and all those other things well. But sleepiness means that you're gonna doze off or feel super sleepy in the situations that I mentioned. If you're ready to doze off, and you can say, "Well, I could really fall asleep if I lie down or watch TV or read a book," then that's sleepiness, and that's a concern. So there's conflicting studies in the literature. One study said those who nap in the afternoon, their risk of heart attacks increases like 30, 40%, something like that. Yeah. There was another study that said those who nap, their risk of heart attacks is slashed by 37%. So who are you going to believe?
Well, that's an exact contradiction of one
Exactly.
another.
So exactly. You dive
Oh
into
my
the
goodness.
other than just finding a cool headline, and some folks want to post it on their social media because they want to shock people and they want more views. That's one thing, but if you dig into the literature, you'll find that those who have an increased risk of heart attacks and everything, those who nap, are anyway sleepy to begin with. So is it a sleep quality issue, like sleep apnea
Mm,
has not been diagnosed, right?
right.
Versus strategic napping. So with my athletes, I call it strategic napping. With my military folk and SEALs, I call it tactical napping. You got to use different words for this.
I love it.
You got to cater to the demographic you're working with. So napping is one of your best sleep friends. How
Okay.
to do it?
Go deeper for me.
Yes, but not as deep as stage two sleep when you're napping. So I'll break it down for you.
I
If
love
you're
it.
getting a nap, to compensate for a total sleep deficit at night, for example, so you've gone out with your friends or you're traveling or you jet lagged a bit, sure. Then you get a nap. To get a nap to compensate for the total sleep deficit that previous night or anticipating sleep loss the next night. So it's sleep banking. You're banking on sleep prior to a night you're going to be sleep deprived. Like some of my NBA guys, they know they're going to have crappy sleep the night before a game, even if it's an evening game. So in that case, the night before, I say, okay, well, go to sleep an hour earlier because your sleep is going to be crappy the next night versus getting a nap day off. So if you have a nap of a fixed duration to compensate for a total loss of sleep that previous night, then it's fine. Some people, like, for example, my college athletes, right? They will go out on a weekend on a Friday night, and instead of going to bed at 11 p.m., they may go to sleep at 1 a.m. And then they stay in, sleep in the next day, which is a bad idea because you're shifting your body through many time zones. What I tell them is, okay, your wake up time is usually 8 a.m. Stick to that 8 a.m. wake up and compensate for the 2 hours of sleep that you lost that afternoon. So you'll make up for total sleep need in a 24-hour period, but you're not pushing your sleep rhythm into a new time zone because it's harder to get back on rhythm. That's one strategy. The other strategy is, what about the average person who's, just needs a little afternoon recharge? And there's no sleep apnea or major sleep issues to deal with, sure, you can get that recharge and get that recharge at a fixed time every afternoon. For example, if you feel sleepy, around 2 p.m., you have that afternoon slump, you can get away,
Mhm.
if you have a 1 hour lunch break and you can get away for 20 to 30 minutes, great. Have an eye mask, earplugs, and do some deep breathing. Whether you get to sleep or not, your alarm will wake you up in 30 minutes. It's recharging. The brain is recharging even if you don't manage to fall asleep. If you do, great. If it's within 20 to 30 minutes, you wake up out of a lighter stage of sleep, so you'll feel more refreshed. But if it's 45 minutes, an hour, you're more likely to wake up out of stage two sleep, deeper sleep, so you'll feel more sluggish.
Yeah.
Right. So a NASA study supported this as well. They found that their pilots who got a 26-minute nap, their alertness and productivity was improved by 30 and 50%, which is huge. So you could get that much
Mhm.
more. You could get that same amount of work in the afternoon in half the amount of time. So you might get home early in the afternoon, right? You'd be that much more productive. And people might say, well, is it going to affect my ability to fall asleep at night? Not really. If it's less than 30 minutes and you're just
Mhm.
compensating and recharging your battery, it should not affect your ability to fall asleep at night. So that's what I mean by strategic napping, tactical napping. And that kind of napping at fixed times for fixed duration to compensate for a total need is healthy and beneficial for your entire system.
I love it. So would we say that going to nap for 2 or 3 hours in the afternoon is not healthy for our system?
Yeah, there's a good reason why you may need so much more sleep, right? So investigate that. Is
Mhm.
it sleep apnea? Is it narcolepsy? Is it that you have
Right.
horrible insomnia and you only get 3 or 4 hours at night? Then that's not normal. That needs to be investigated. Now, some people can do this, the Uberman protocol. So a few hours, like 1.5 or 3 hours of sleep in chunks, and then chunks of wakefulness and chunks of sleep. Leonardo da Vinci was famous for doing that. Worked for him, some other people as well, but not everyone can do that. Historically, anthropologists say that we've had bimodal sleep, maybe 4 hours in the early evening when the sun would set, and then wake up in the middle of the night for a few hours and then back to sleep until the sun rose. That worked then. It doesn't work now for the most part. So if you need 3, 4 hours of sleep in the afternoon, it needs to be looked at.
That okay. I feel like I'm just gonna have to have you back on the podcast, to be honest, because I have so many questions in my head right now. And in all honesty, I'm just gonna bring you into concussion nerds and we're just gonna get like all your attention again. So because insomnia is so prevalent in our TBI population, what do you say? It's like 50% of people with TBI suffer with
Right?
insomnia. Is that what you said?
Yes.
So we know that we need to connect them with someone who can support them. So, two questions: who do we connect them with? And the second question would be, what are some initial, if someone has insomnia, what are some initial things they could be trying to do on their own while they're waiting to be connected or while we're searching for someone to connect them with?
Okay. So it's important to connect those with head injuries with people who are specializing in dealing with people with head injuries, sports, and sleep. Now, primary care doctors will often just give them Ambien or trazodone or a medication without looking at underlying factors.
Yeah.
Then you have some sleep psychologists who do cognitive behavioral therapy for insomnia, which is the gold standard for that. And I do that as well.
Okay.
But there's huge wait times for those folks, and not many of them are trained in concussions and athletes. That's a hard one. You could always send them to me. I mean, happy to see your
Oh, look at,
folks.
I was like, do you consult around the world?
I do. I do. I do.
Okay.
I do it on
Okay.
Zoom. I consult with athletes in the PGA Europe, in Spain, everywhere. So I do that.
Perfect.
But to start off with, we have to understand what insomnia is in the TBI population. Insomnia for this population is an excessive wakefulness of the brain. Because after a concussion, it's like your nervous system is on edge, right? And you know what this
Hmm.
feels like with post concussive syndrome? It means migraines because your nervous system is very readily triggered into catastrophe. It might mean a short fuse, emotional instability. You might feel like you're in jet lag mode. Your anxiety may go through the roof. Your nervous system is engaged. It's been traumatized, and so its defenses are up. It's ready.
Hmm.
It's ready for another attack. And if your nervous system is engaged, overwhelmed, stretched real thin, you have other aspects that are impacting your ability to fall asleep. Sleeping is the most vulnerable thing that we do, and your nervous system has to be able to be vulnerable in order to be able to fall asleep. What does the average doctor do? Tries to knock it out. No, it's
Hmm.
about recalibrating that emotional thermostat
I
back to
love
its
this.
baseline, right?
Hmm.
How do we do this?
Hmm.
Because you're sensitive to sound, sometimes you're sensitive to light, sometimes you're ringing in the ears. It's all an excessive overwhelm of the nervous system that's resulting in these sensitivities, in these emotional overwhelm situations, right? Your nervous system is in danger mode, it's in frozen mode. And to slowly recalibrate is where we're at. So how do you do that? Calming supplements,
Okay.
ashwagandha, L-theanine, magnesium, inositol. I didn't
Mhm.
mention melatonin intentionally
I was
because
like, there's no, I noticed that.
it's not the best one. There's certain calming strategies to calm the busy brain down in terms of meditation, progressive relaxation. Physiological sighing is one of my favorite, most powerful strategies to recalibrate the
Mm.
nervous system. It's basically double
Yep.
inhale and a long exhale, right? Inhale, inhale,
Mhm.
slowly exhale as if you're blowing out through a straw. Winding down before bed, so an hour before your desired bedtime. Maybe put some sunglasses on, pretend you're Elton John or Bono, meditate, no screen times, be sauna, keep hydrated because even a slight drop in hydration, more stress hormone your body feels is going to dehydration danger mode. Make sure you're not eating any fast carbs or sugars right before bedtime or even with your nighttime meals. So make sure it's more slow carbs like sweet potatoes and protein. High fat will make
Mhm.
cause indigestion. So remember the foods and the timing of foods, winding down before bed, writing down your to-do list, writing down your worry list for the next day. There's so many good meditation
Mhm.
programs online and apps, YouTube. Choose what works for you. Your brain needs to know, even that warm shower, brushing your teeth, your brain needs to know it's going through a ritual to wind down because you can't just switch on and off like a light bulb. But keep that wake up time locked in. So even
Is the
during the,
wake up time more important than this go to sleep time?
yes.
Okay.
And when you wake up, no snoozing.
Oh,
Okay.
but my bed is so comfortable.
Yeah. It is so comfortable. And so is post concussive syndrome, sadly. So when you wake up, get some sunlight on your face. Do some deep breathing. Have some warm water. Do some jumping jacks and stretches. Getting the sunlight on your
Mhm.
face is critical to drive down your melatonin and lock in the walls between sleep and wakefulness. And
Mm.
a lot of people who've had a concussion, they have visual processing difficulties, like Erland syndrome or convergence insufficiency. They may
Mhm.
have had whiplash and the neck is hurt. And then, as you must know about the craniocervical syndrome, atlantoaxial instability, dysautonomia, where the nervous system, the fight and flight one, is in dominance compared to the parasympathetic. So, vagal nerve
Mhm.
stimulation. It's about recalibrating that emotional thermostat. And it will happen with time as long as you're consistent and have those training wheels on. Your brain will relearn how to calibrate back between 0 and 50 and back to 0 instead of 30 and 150 and then 40 and then 180.
Okay, I love how this conversation just unfolded because obviously, like, I've watched your social and I've read your book and chatted with you before, but the nervous system is my jam. So to hear you talk about sleep in relation to the nervous system and sympathetic overdrive and dysautonomia, that's the first time I've actually heard someone talk about treating sleep by treating your nervous system. And the link that you made, it's beautiful. And I literally just finished teaching last night a 3-part workshop. I call it Your Human Foundation, because to me, our autonomic nervous system is our foundation. And we want to strengthen our human foundation. And I always say to people, no part of the nervous system is bad. Every part of our nervous system serves a purpose. The problem is that, especially after concussion, we get stuck in, I call it activation levels of the nervous system, and we aren't as dynamic and we don't respond as appropriately. And so the whole workshop was truly about teaching people how, because what happens, I find in the TBI space too, is people stop trusting their bodies. And so they become dissociated and they're disconnected and they don't feel what's happening. So the whole workshop was about getting reconnected to your body and your own nervous system to be able to identify ourselves, the signals our body's sending us when we're in ventral vagal, sympathetic, and dorsal vagal. And I just love how you linked sleep right into that. And the other beautiful thing that I love even more, this is just great, is when we talked about at the end of the workshop, how do we continue to build resiliency and capacity within our nervous system? It's about routine. Like yes, sometimes we need to connect with professionals, but there's so much we can do on our own around the routines that we choose And just hearing you kind of solidify that with these simple practices of don't hit snooze, put your face in the sunlight, calm the brain, literally build a routine and a ritual so that our nervous system understands and can predict what's happening, which removes the uncertainty, which is a piece of what causes our anxiety and our hypervigilance. And so to hear you link sleep back into that, I wasn't expecting it, and absolutely beautiful.
You summarized that incredibly well. And this is why we do what we do, right? Because we can read all the academic journals in the world, but to be able to make it applicable to anyone who's listening to us who wants to change their lives now, right? This is where we take the
Mhm.
academic fancy stuff from all the big medical institutions and the laboratories across the world to people's homes.
Yes. Shane, thank you so much for being here. I was like,
Let-
this was 37 minutes of like jam-packed knowledge. I can't thank you enough for sharing your passion. And I feel like we could just talk for hours. We have your book, which we're going to drop the link on Amazon in the show notes for people. It's a fabulous resource, you guys. It's an easy read too, right? So he like quotes the research, he shares the research, but it is an easy read. You can get through it quickly and it's got applicable things for you to take immediately to try in your own life. It's a fabulous, fabulous book. I love it. We're going to drop your website, your Instagram handle. What is the best way for people to connect with you if they want to connect with you?
Yeah, so my website is under construction right now. The best way to reach me is DMing me on Peak Sleep Performance. That's the Instagram, and connect with one of my staff, or email me. One of myself will get in touch with you at info@shanecreado.com. Those are the best ways.
Amazing. Thank you again so much for being here. I appreciate you and
Well,
the magic you're bringing to the world. And for everyone else, connect with Shane. Go follow his Instagram. He puts fun tips on there. It's just amazing human, wealth of information. And we will see everyone here next week on our next episode. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.